welcome to the Young Indian Professionals of New England talk show series with the professionals. On today's episode, it is a bit different than what we normally do. We are having a mental health panel discussion to talk about issues that are not discussed in today's culture. Today, we're so honored to have Dr. Raju Singla, Dr. Seema Arora, and Divya Sharma with us on today's discussion. Thank you all for being part of today's episode today.
Thank you, Niharika, for having us over.
Yeah, thank you. Pleasure to be here.
Of course. So first we would like to start with, could you all please give us a little introduction about yourself and your professional background? So Dr. Raju Singla, we're going to go with you first.
So I did my medical college from SN Medical College, Jodhpur. And then I came here. I did my residency from Roger Williams Hospital in Providence, affiliated with BU. I've been working in medicine for last 22 years. I'm board certified in medicine and hospital medicine. And I'm the director for the hospitals division for last 15 years. And I'm happy to be here.
We're so happy to have you. Dr. Seema Arora, would you like to go next?
Yeah, sure. So I am also from India. My background is that I was born and raised in New Delhi, and I went to med school in Lady Hardinge Medical College, New Delhi. I came here and did my residency at Mass General Brigham in Salem, Massachusetts. And ever since I've been on North Shore practicing for about 25 years. I practice in Peabody in internal medicine. I'm board certified in internal medicine. A lot of my practice is also addiction medicine and mental health. And I'm also affiliated with Mass General Brigham in Salem. And I'm also the medical director of Medi Weight Loss Clinic in North Andover. And on the side, I also practice medical aesthetics.
Wow, that's great. Thank you. Divya, would you like to go next?
Yeah. Hi, everyone. My name is Divya. I was born and brought up in Boston, and I'm currently a graduate student at Tufts University, focusing in healthcare informatics and analytics. And I'm working as an EHR specialist, more, focusing on the electronic medical record platforms across all platforms, such as Epic and Athena Healthcare, focused in vascular care. And so I'm combining my passion for data and healthcare together, and happy to be here.
That's great. We're so happy to have you all on board. If viewers, you might not know, but you may or may not know, but I'm also in the healthcare management side of things. So I definitely will have a different side of aspects for today's discussion. So today we would like to introduce the mental health issue in the Indian community, just because it's a very important issue that isn't talked about in today's culture and the conversations we typically have with our friends today. So one issue that the youth of the Indian community face is a struggle with mental health. Mental health is a topic that is not very much discussed within our Indian culture in America. People who are struggling with mental health are often tagged as lunatics, crazy, possessed, and many more by society. Individuals in the Indian community consider people weak if they deal with mental health issues. This leads to a vicious cycle of shame, suffering, and isolation of the patients. Mental health is not a topic that is discussed within the Indian culture. It is known that the young South Asian women have higher rates of suicide than a general US population. Dr. Raju Singla, do you have anything to add about the mental health issue in the Indian community?
So first of all, as you said, it's a big issue that we don't want to talk about. Most of the time, people don't want to talk about their mental health issues. So I've been practicing primary care for the last 22 years. So this is one of the most important things that I tell my patients. Physically fit is important, but mentally fit is more important. You have to be mentally fit. So I think in our community, the pressure of being successful is so high. We all want to be successful. We all want to look good in front of everyone, that people don't want to talk about their mental health issues. So I think creating an awareness is very important. Creating an awareness that, hey, listen, it's not that you're just having a bad day or you're going through a bad phase of life. You're actually going through depression. Identify the signs and symptoms. Be aware that there is a mental health issue. And then identify who can you speak to about it. Like, is there a family member that you can talk about? Or you go to your primary care physician. But it's very important that you identify the mental health issues and go to the right person. There are so many channels now available. So I think my biggest thing is that people don't recognize that they have mental health issues. People are shy to talk about it. They feel like it's a taboo, especially in the Indian community. Like, we put so much pressure on our children that they have to succeed in life because the parents have done.
Yes.
So the kids have to do well. So I think that is like, that causes a lot of, plus there's so much peer pressure these days. There's so much out there that, kids go through. Even professionals during COVID period went through a lot. So, healthcare professionals, I mean, I'm doing a workshop on depression in healthcare professionals these days, because that is another big issue. People went through a big change in the medical system during COVID system. So I think awareness and realizing that you have a problem and finding the right person to talk to and identifying the resources.
I think you bring up really great topics, which will be discussed later on in this episode. We will dive into more of these important issues that you bring up today. Dr. Seema Arora, would you like to add to the mental health issue?
Yes, Niharika, I totally agree with both of you, whatever you said so far. And I know that we are going to break this up and take each one of those topics and talk about it. But in general, what I want to say is that, mental health is such a critical topic right now that I'm glad that we are discussing it today, and thank you for bringing this up, and especially for young adults. In general, it is said that in 2030, it's going to be one of the most, the biggest morbid condition of the world.
Wow.
And it's going to be a crisis. Not that it's not right now, but it's going to be the biggest crisis in America as well. So our Indian kids are facing a double problem because of the outer society pressure and the inner society. Outer society meaning Americans, and inner society meaning our own Indian community. So like you all said, there's a lot of pressure from Indians. They want their kids to be perfect, highly achieved, and they also have this double cultural identity crisis. And because of all that, they put a lot of pressure on themselves. And the shame thing is a very big thing. Stigma is so much in an Indian community. They just want the kids to be perfect, and this is considered a weakness of our own family. So we'll never go and tell anybody about that if our kid has it or if somebody in our family has it. So we ourselves, I'm a mother of two young adults like you. I'm a same age daughter and son. So I can speak as a mom and as a doctor that what kids go through. And so awareness, removing the stigma, and then knowing what resources we can use. And also for parents, I would say it's very important for them also to recognize what their kids are going through. And I think later on we can talk a little bit more about that suicide rate is so high amongst young adults. In general, this is the second leading cause of death in young adults ages 13 to 19. And amongst Indians, it is the leading cause of suicide.
Wow.
So
That's
yeah.
a very impressive, not impressive, but like very detrimental statistics.
Yeah, so I think recognizing the symptoms, we can talk more in detail about that, how we can recognize the symptoms and then what we're supposed to do about it.
Yes, no, for sure. We will do that in today's episode. Divya, would you like to add anything about mental health in the younger generation today?
Yeah, I think in the aspect, they covered it very well, but I think in the aspects of the younger generation, coming from a very traditional Indian family, yeah, it's definitely, mental health. I think it's getting there. Now it's more, openly spoken, especially in the US. I'm not sure how the, mental health stigma is in India, but I do feel like, especially in the younger generation, as when I was younger, I know that mental health was, it was just not spoken about. Families around me and my friends wouldn't consider that something to be discussed. But now I see that the generation is a little bit more vocal, and we have social media. I think the huge impact that social media has helped the younger Indian community have more of a voice and speak out regarding their mental health problems, and they're not ashamed of it anymore. I do see some sort of change, but there is some sort of stigma still around it.
Yeah, so I think that's very important. Social media is the future of healthcare and also the future of how we can bring awareness to these situations. So we'll definitely talk about that later on in this episode. So today I wanted to touch on a few topics about mental health. You all brought it up in some shape or form when you were introducing it, but now I want to do a deep dive on these topics. So the first one is societal pressures. In the Indian community, many young professionals and individuals face the issue of societal pressures. For example, parents keep putting pressures on their kids that they need to ace everything, otherwise they'll be considered a failure. I know in my generation or my friends are like, oh yeah, we need to get 99% because our parents will ask where the 1% went. And we always have a situation or like a thing that everyone needs to be like in an Ivy League college or need to be like the best of the best. And also people have the issue of how are aunties and uncles going to react if they don't get to where they are today. So do you think it's a good idea to put these kind of pressures on young individuals, and how does that affect their mental health? So Dr. Raju Singla, you can go first.
So as we all know that our Indian communities thrive on success, and we all are always, we all hope that our kids do well. And I'm a mother of two adult kids now, so I've gone through this personally. There was the way we were raised, when our parents said something, we would just say yes. Okay, we were expected to be a physician, or we were expected to do well in life. Okay, when my kids were growing up, initially, we were the same. Okay, they're going to go in medicine, they're going to do this. But eventually I realized that these kids are going through so much peer pressure. They're going through this, as Seema said, they're going through double cultural identity crisis. They're going through, plus at some point in life, they also, maybe they don't want to do medicine. We have to realize that. So, putting too much pressure on your children that they have to go to Ivy Leagues, or they have to do well in life, or have to have a career that's going to make a lot of money, I think that's just something that we should all grow out of it now. I think as an Indian community, or any community, I think, we just need to I think we need to accommodate our kids more. We have to understand what they're saying. As my younger one always says, talk to me, because, you're not even listening to me. And I think then I realized that when he was in college, whenever I used to say something, no, you need to do this. Like, you mom, you're not even listening to me. And then I realized that, yeah, he's right. He has got his own point of view. And kids these days are very savvy. They are more technology savvy. They have more exposure with the social medias, internets. They know what they want in life very early in life. We were very naive, I think, when we were kids. We didn't have that much exposure. So we kind of went with the flow. These kids have more exposure. They are very smart kids, and we should listen to our kids. We should listen to what they want to do in life. I think that's what Indian community or Indian parents, I think we as a community need to do, that we need to listen to our kids, see what they want to do in life, and accept it. Okay, not every kid is going to go to Ivy League, and it's okay. They will probably do the best in whatever they want to do. So I think
Important.
take away that pressure, the suicide risk or depression risk or everything will go down. We need to learn to talk to our kids, which we don't, unfortunately.
No, that's very important. You did mention that everyone needs to be a doctor and all, like, or like some type of STEM field, or I know there's a saying that everyone needs to be a doctor, engineer, or lawyer, but we need to normalize other career paths because those are also very important. In today's culture, we need everyone that is very, very well-rounded, like music, arts, or we need to normalize that that's okay too, and people can be successful because of that.
And plus also, if your kid is going through a tough time, don't ignore it by saying, oh, you know what, it's okay. You can be strong. You can do this. Identify that early ahead, that, okay, my kid is having some trouble. We need to be there for them. Identify the signs of depression, or they're not coping well. Depression, suicide. So be there for your kids. Talk to them. I think that is the biggest thing you can do as a parent.
No, that's very important. Dr. Seema Arora, do you have anything to say about societal pressures and mental health communities?
So I definitely would like to add to that you know, like you all said, everybody doesn't have to be a mathematician, doctor, engineer, lawyer. I agree with that. You know, my own two children are so different from each other. One is towards a creative path, like you said, and the other one is towards the academic path. And for me, myself, it took me a little while to understand that a creative path can also be a career. You know, coming from Indian mentality, we think that that can only be a hobby, that cannot be a career. You know, on this side, you can do music, acting, stuff like that, but it cannot be a career. We have to have something, you know, you're going to go out there and make money. And, you know, my daughter said to me, I'd rather be in an apartment and be happy and follow my passion than be in a big house and be unhappy. So it took me a while to understand that, but I understand that now. I think we are in the land of opportunity, and why we are here, why we struggle this much. You know, our children have all these resources. There are so many things they can do. So why put that pressure on them that they have to be Ivy League and, you know, they have to, you know, be making this much money, or, you know, success is not all about money. I think success is about being happy and following your passions. I've come to understand that now. So when you understand your children and you support them, and you try to early on recognize, you know, what they want, and be open with them and let them talk, and just not talk, listen to them, you know, what they're saying. And sometimes young adults, they just want a listening ear, you know. And you also have to recognize sometimes they're not even asking for your advice. And this I heard, you know, my son is graduating next year from next month from Tufts, and his college principal said this, that you just need to provide a listening ear and ask them, do you want my advice, or you just want a listener? You know, sometimes that's all they need. They just want someone to listen to them. And be very aware of the signs. You know, you have to be very, very vigilant. Just keep in the loop and be very aware of the signs of depression, because depression and anxiety are the two very top causes of mental health issues right now. Anxiety is number one and depression is number two. And if you see that they're isolating, or they're showing something, you know, some signs of diversion, they're not themselves, they're not able to talk to you, you need to ask them, how are you doing? How was your day? But if don't say to them, don't just, you know, what they're saying, just don't say that, oh, come out of this, you're just worrying too much, you're overthinking, you know, just go there and do it, work hard. So this is what we Indian parents tend to do. So don't invalidate them. That's called, in their language, which I get from my children, don't invalidate their feelings. So try to say, yeah, I understand what you're saying, and be very aware of signs like, you know, if they're cutting themselves, or if they're saying that I want to kill myself. Don't take that lightly. Don't think that, oh, come on, you know, you can't even handle this much pressure. When we came from our, you know, that's what we do. We're, as immigrants, we went through so much. When I was little, you know, my parents did this, blah, blah, blah. When I came to this country, there was so much pressure. Don't invalidate their feelings. You know, what they're saying, if they're saying that I want to kill myself, I want to die, take that very, very seriously. And get them some help, and let them come out with their feelings, and let them talk about it. And if you need to take them to a therapist, make them also feel comfortable about it, that therapy and getting medical help is not a bad thing. They're not crazy. First of all, people even say that, oh, if you go to a doctor or psychiatrist, you're crazy. You're a crazy person. So those are the stigmas in community in general, but more in our community. And I still feel that there is. So you're going to save your children a lot of trouble and a lot of suicide and mental health problems if you, first of all, change your own mentality, and then you are very aware of those signs and symptoms.
That is very true and very impactful. Thank you for all that. Divya, you have anything to add about societal pressures?
Yeah, I think peer pressure, especially growing up in a large Indian community, peer pressure has been very like prevalent within, my, all around, like all the kids around in my generation know, they're doing that, they're doing this, you should do that. So I've seen it all around, and I know that can, be the number one cause of anxiety. And I think as we were discussing, I think people in general, especially parents in the Indian community, must stop and think. And I think to remove this stigma, people just need to be educated about the basics of mental health instead of saying, to their kids, this is the number one line. I'm sure you've heard of it. What will others think of you, right? Log kya kenge, right? I think that's the number one line anyone in my age group has heard. But so parents who could very well know their child is not doing well mentally, but still will wait till the last possible moment just because they cannot accept the finger pointing and the name calling that would be associated with this disease. And I think that needs to change, and that will change within our community if people are just more educated about the basics of mental health. And it's not, just because if you do have a mental health disease does not mean you're crazy.
No, that's for sure true. I definitely know, like me growing in a lot in the Indian community, my parents were very heavily involved. I was always scared to go to these events because I'm like, what am I like? Will people think of me differently just because like I am still in high school, like I haven't achieved this much. But then I realized after college and everything else that like I just have to do things for myself. I cannot do things because like of what others will think of me. I have to do things because of my own achievements. And we cannot rely on societal pressures for our own individual success. We need to rely on who we are as an individual and what our goals are. And we just have to be a competition of ourselves. We can't be competition of others because then that just loses our personality. So definitely growing a lot in the Indian community. I know that aunties and uncles might talk about other kids in parties, and I would hate that because I would be like, let's just focus on ourselves and let's not to talk about this because individuals are going to have their own success stories, and I know that could put a toll on mental health, and it's just a thing that we need to discuss, and it's very important that people in the Indian community should know that there are limits and boundaries, and people are their own individuals. So on that basis, I want to also cover lack of education, because I know that in the Indian community, especially in India, and also in the American Indian culture in America, there's a lack of education and awareness concerning psychological issues. Many young adults experience mental health problems, yet social stigmas and negative attitudes towards mental health prevent them from actually seeking the support they need, since people are scared that what if other people find out that they're seeking mental health treatments, they might be looked down upon. What do we all suggest to break the stigma and promote education in the Indian community about mental health? Dr. Raju Singla, do you want to start first?
Yep. I think being aware of what resources are available is very important. First of all, as an Indian family or as an Indian community, we've already talked that the important thing is to be aware of the signs and symptoms that mental health exists, and it could be possible that one of your child is suffering from it or one of your family members suffering from it, and accept it and then bring them to the right person. That's important. But I would like to point out that there are a lot of online resources available now. There are a lot of online apps available, online resource available, where you can actually go and there are questionnaires, there are different materials that you can go through, and that will help you identify whether you actually have a mental health issue. And then you can go to the right person. They can guide you. There are a lot of online psych services available, like counseling services available. So there's a lot of help available now, and people need to be aware of that. So during COVID years, I found out that not that I didn't see a lot of addiction problems that always existed, and a lot of anxiety and depression problems existed, but it kind of escalated during that COVID pandemic phase. So what I did that time was I created a group. It was a small effort on my side. I created a group called Hopes and Heights. And what we do is we created a panel of specialists in different fields, like in the community, like the various psych centers, psych nurse practitioners, even the EMS services, local emergency room physicians. We kind of created a group, and we do workshops where it's open to the public, and we provide resources to people. People can just walk in. They can, there's always discussions going on. There is always services available there, and there's a lot of we distribute pamphlets. We distribute a lot of resources so that, and they know hotline numbers, a lot of things that they can approach, and they can get help if they need to. So I think creating awareness of what is available is important, because people, okay, once you've identified there's a mental health issue, then people are scared to go to a physician. They're scared to talk to anybody about it. So you can even go online and do a lot of help is available there. That's what I'm trying to say. And a lot of resources are there. So I think approaching those resources and trying to get to the right person is the key here, because once you get help, you will feel you're a totally different person. Once you get your right treatment, you get the right counseling, you feel like, okay, I'm back to my normal self. You begin to enjoy life again.
True.
So it's that you use all the resources that is available. And there's a lot of people are working so hard to provide those resources to you. So we just need to make sure people are aware of those.
That's true. Yes. That's very important. Dr. Seema Arora, do you have anything you want to say about lack of education in the Indian community about mental health?
Yes, so Niharika, I would like to break it down into two components. One is for the young adults themselves, and one is for their families. So for the young adults, you have to be, first of all, aware of the symptoms that you are having a mental health issue. Is it really a mental health issue, or is it just part of, sometimes you think it's just life, chaos, growing up, so if you're having too much sadness, eating problems, sleep problems, anxiety, or mood disorders, and you think that you can't handle it, first of all, don't be shy of asking for help. Go and tell your parents about it. Don't just isolate about, or your peers, not necessarily your parents. If you are not comfortable with your parents, you can talk to somebody. You can go for counseling in your school, in your college. Don't isolate yourself. That's the worst thing you can do is to just isolate and don't talk about it. So there is a lot of help available, but first of all, you have to be open, and you have to recognize that you have a problem there and it can be resolved. So like Raju said, there are a lot of resources available online, and there are so many organizations. You can look up for that. And I would also say that there are a lot of groups also available. You can join support groups, maybe in your own college you have, or you can create one. If there is not, that's something that you people should be looking at, like other support groups we have with your own peers. And you can go to, don't feel shy of going to a therapist. Like I said earlier, it's not that you're crazy, that if you go to a therapist and if you're on medications, it doesn't make you crazy. So we have to break that stigma. And for the family around us, that we have to be very supportive. I'm a part of many social cultural organizations, as some of you know, American Association of Physicians of Indian Origin. I was chair board of trustees for that, Indian Medical Association of New England. I was president of that and president of United India Association of New England. And we're doing all these kinds of webinars and educational events and social events. Actually, last year was our mental health year for API, one of my organizations. And we did a lot of education in India over here. And United India Association is actually holding a wellness event in Shivalaya Temple next month. So, mental health will be a part of that as well. So we should take advantage of these events and these educational and medical and social cultural events. Also take the opportunity to maybe take our young teenage children or adolescents or young adult children along with us. And that may also, connect us with them and also educate them. Sometimes we cannot talk to them, and it registers more if somebody else talks. And if you catch it early on, then definitely, suggest that they should talk to a therapist and offer that help. And like I said, first we have to educate ourselves as adults and then educate our children. And I would have loved to see that, your colleges or your schools had more mental health education, but unfortunately, I've seen that there's not enough, mental health education. So someday maybe politicians should, and the government, should be approached, and, some of us maybe work on that and make that our next agenda.
True. Yes, that's a great point. I think everyone will benefit from a mental health break, or like a mental health holiday. We should definitely enforce that in the professional world as well. Divya, do you have anything to say about societal lack of education?
Yeah, no, I agree with, I'm not sure if there's like a lack of, mental health resources in college. I do think that they're there, but then again, there's, I think a lot of times students or a younger generation is a little bit hesitant to just approach these resources. They are, I sometimes feel like they might need a push because they're also afraid of, because it's something new. They're not used to it. But, having said that, there's a myth, talking won't change it. But sometimes I think one needs to tell someone, and, one wants to escape those feelings and should not remain, silent and work towards, removing the stigma around mental health. And I think the perception is, as you're silent and, it might go away just by magic and thin air, but that's not the case. There are many resources, and I would just like to encourage the young generation that there are resources out there, and, I would tell them to have the courage to, move forward and, seek help, and, instead of suffering in silence.
That's very important. I know we all mentioned about therapy and some she performed during this topic discussion, so I would like to deep dive more into that. So, in terms of treatment issues, when mental health disorders are mentioned, there's a lot of focus on the physical symptoms. People in the Desi community don't understand that mental illness exists because of the lack of the cure. How can we break that stigma, and how can we make believe that mental health is not caused by supernatural or spiritual factors, but it could be believed that we can educate people that it's not because of this supernatural belief. How can we make sure that that this is a very curable disease if people can get therapy? So Dr. Raju Singla, do you want to go first?
I think the key is education. You have to educate people. Again, creating awareness that, mental health issues are not supernatural, or they're not, somebody's not pretending to be depressed. Somebody's not, just because the kids don't want to perform in school, that's why they're pretending. You know, sometimes that's also another, you know, the kids, the parents will be a little harsh on their kids by saying, you know what, get out of it, get over it, you can do it. I think being aware that the mental health is actually an illness, and like your physical health is important, your mental health is very important. So, you know, people need to be educated that depressions, anxieties can lead into long-term, you know, illnesses in life. They can end up with severe panic disorders. They can lead to suicides. They can lead into major depressions, bipolar disorders. You know, they can create a lot of major issues in life that they will never be successful. You're trying to make them successful and you're trying to push them too hard, and they would actually push them into a deep well of, you know, just darkness. So I think creating awareness and then providing them with resources, like as you know, Seema said, you know, they're doing these workshops, or, you know, going to these events, not avoiding these events like oh my God, mental health awareness event, who wants to go to that, right? Because that's stupid people talking about these things, but that's not actually the case. This is going to be a big pandemic coming in another 10 years, because it's going to be, even now, 1 in every 8 adult ER visits is a mental health visit. 1 in 8 every ER visit. This is the real statistics. It's the biggest problem which is happening right now, and we need to accept it and then educate people about it. And then, you know, the resources are available everywhere. It's not that, you know, you can talk to your primary care physician. You can actually talk in the school and colleges. They have counselors available. They have, you know, resources available that they can provide your kids with. There are online resources. There are, you know, you can go to your town. You can go to the fire stations, ERs. There are resources available everywhere. So it's not the lack of resources. It's the lack of ability to explore the resources. People are not, first of all, it's a stigma, as we all agree on. So get out of that stigma, accept that, you know, treating your mental health is the most important. If you are going to be mentally healthy, you'll be physically healthy too, because you'll be more motivated to be successful in life and, you know, eat healthy. And, you know, don't ignore the symptoms that I'm sleeping too much, I'm not eating well, I don't want to mix up with people, I just want to be by myself. Don't ignore these symptoms when your kids are doing that, you know. So I think that's how we can educate people and have them explore the resources that are available.
I do agree with that. Dr. Seema Arora, would you like to talk about treatments that young professionals could do for mental health?
Yes, Niharika. So coming back to the point that you made, that it's not like something which is like a magic or, you know, some kind of a voodoo spell on somebody. So there can be two causes. One can be genetic, one can be environmental, or a mixture of two. So, you know, if somebody in your family has, you are more predisposed to mental health illness. And sometimes we don't even recognize that, because in earlier generation, it was even more of a stigma. So, you know, our maybe our parents, grandparents, uncles had it, and we didn't even know about it. But now, as the awareness is increasing, we can find out about that. And then, of course, the environmental causes that we've been all talking about, the pressures and all that kind of stuff. So those are the real causes. And like any other physical illness, diabetes, hypertension, heart disease, we can treat this in today's day and age with medications, therapy, and we can lead a very, very normal life. So it's not something that you have to suffer so much and lead a life full of shame, a life full of suffering. This is what we need to convey to adults and our youngsters, that this is something very, very treatable, very curable, and maybe even if you have to take a medication and you take 1 pill a day, like you take for treatment of high blood pressure or diabetes. So it's just like having a physical ailment. You have mental ailments, you know, this is one of your organs, is brain. So if your brain is having a disease, you treat it just like you treat your heart or your lungs, right? So we have to make ourselves understand that, and we have to make a, I think that's the way the stigma is going to go away. The other very, very, very common and very, again, shame-based problem that, you know, I deal with a lot in my practice because I specialize in addictions as well, that when these things are not taken care of, sometimes it leads to addictions in young adults, and they go after drinking or drugs, and then things even complicate even more. And parents need to recognize that if they see that their youngsters are drinking too much or smoking weed or going towards drugs, then they need to not, pressurize them even more so they go towards that path. We already talked about suicide, but this is the another thing that is going to kill them. So just take them early on for treatment. There is treatment available for addictions as well. And this is also another chronic illness. I would say that don't be shame-based about that. If somebody is in addiction, there are detoxes available, there's therapy available, there are medications available. So get treatment, and after that, you can lead a normal life. So so these are the things I think we never talk about in Indian community, especially. So I think we need to talk about this more, and we adults and children have to be aware of the symptoms, like I mentioned before, and treatments. Another thing that you people can do yourself is exercise, eat healthy. Sleep is very important. I know that, it's you have to party sometimes in college, you have to study, you have to keep awake. But, if you are deprived too much of sleep, you're going to push yourself more into anxieties and depressions and mood disorders. And another thing is eating disorders is very common. Trauma in a child, sometimes childhood trauma can lead to all these problems, ADHD and PTSD. So there are various causes. Therapy can take care of that, but you need to live a healthy lifestyle. Wellness, it's very important. You need to exercise, you need to take your vitamins, you need to have sleep, drink enough water, and diet, and also just give back to the community, like you're doing doing these episodes, and involve yourself in the community. Do something creative. When you do something creative, your depression goes away. You feel better, and you feel healthier. Involve with your peers and talk to them. Don't isolate yourself. Loneliness causes more of these problems. So those are few things that I would say, aside from medical treatment, that you can do. Yeah.
You definitely bring up some really good factors, and all people should take that advice and follow what you just said for the regimens of treatment. So Divya, do you have anything you want to add about treatments in mental health for the younger generation in the Indian community?
Yeah, I think both of them have covered it really well regarding, medications and therapies that can be used. And, I think basically, just my advice for the younger community would just be, try to live a healthy lifestyle. It can be tough in college, as that we were saying over here. But, I think also trying to find a hobby or something that makes you happy. I think if you're happy from within, that, and not being isolated, being around, more of your friends, like, I think that absolutely makes me happy, being around my friends and family, and doing something that you love will definitely help. In my belief, is probably one of the biggest treatments in mental health, is just doing what you love, and set aside some time to for your hobbies, your passions, and these sort of creative aspects that make you happy.
I do agree with all of that. You all bring up really good points, and the viewers and the young professionals of New England should take that. And if people are going through mental health situations, they should definitely go for therapy, because we don't want to be sitting in silence and not getting the treatment that we need. So on that note, I know that we mentioned social media as a future of mental health awareness. Dr. Raju Singla, what do you think is the future of mental health and in the Indian community in our for mental health?
I think there's a lot of awareness now. So I think the future seems to be bright in the sense that, people are getting more aware of these problems, and the parents are actually becoming more open about it. And I think what we need to do as a community is create more open discussions among each other about, like, hey, my kid has this problem. What did you do about it? Things like that, so that we can create better support groups, um, therapies leading, and people are becoming more health aware now. So they're leading towards, like, having open discussions with their children. I think the future is bright as long as we make it bright. I think we need to work on ourselves. I think we need to work on the parent-children equation. As I said, the day I started listening to my children, my whole outlook changed. Because before that, you should not feel like your kids should follow a certain standard set of rules. They may have their own, rules that they want to follow. So you need to understand them. You need to listen to them. I think that's the most important thing. You need to identify the signs if there is any. You need to make sure that they get to the right person, right treatment. Again, if it's a mental disorder, it can be cured, it can be treated. So I think as an Indian community, we need to, the future seems to be good. Social media is going to be the big, the main platform for creating awareness. It already is, and in the near future, I mean, as I mentioned, there are so many online resources, online apps, online counseling services, physicians available to talk. There are these hotline services for suicidal, services, and there's so much available now. The creating awareness is the most important thing, and I think we are there. We're getting there. We're slowly getting there, and I think Indian parents are actually they're learning to accept that not all kids are going to be physicians, and not all kids are going to be, they need to enjoy what they do in life. That's important. They need to.
Yeah, that's some great advice for the future. Dr. Seema Arora, what do you think is the future of mental health in the Indian community?
So Niharika, like I said, in community as general, mental health problems are increasing, and we're saying it's going to be an epidemic. It already is, and leading cause of morbidity and mortality in 2030, leading cause of suicide in Indian American community. So we really need to take this very seriously. We can't just sit and talk about it. We really need to take action at this time. And like I said, it starts, genetic environmental predisposition. It starts early on in your age. About 50% of the cases are seen by the age of 15, and by the age of 24, you see 2/3 of the cases. And our young adult brains are still developing till about the age of 25. So that's why this age is very important. 20s are said to be the toughest age. I read it somewhere. So 20s are even tougher than teens sometimes. And as you've gone through these pressures, and I have 2 young adults in 20s. So I feel each kid is different too. Some go through it, some don't, but these are what the numbers are, what data says. So in the future, it's going to increase. That's what it looks like. So from our side, what we've been talking about so far, like we need to spread awareness. We need to destigmatize, especially in the Indian community. Children, I already talked about what they should be doing and what they should be looking out for. Parents also, I talked about what they should be doing, what they should be looking out for. Medical help, support groups. My daughter made a support group at BU. So you go to BU, I know she's your peer. So these things you people can do yourself. And whenever you ask for our help, we're always there too. So I think we need to get people, not general community, but we have to get politicians involved in this. And we have next month, for example, is also awareness month. May is a mental health awareness month. And we can do more events. We can do more awareness stuff that we're already doing. SAMHSA is another organization that is organizing a lot of events next month. And I encourage that we all, look into that and be a part of that. So I think we are making efforts to move in the right direction, but there is a lot of work to be done. There is still a lot of work to be done.
True. Thank you so much for that. Divya, do you want to go next about the future of mental health in the Indian community?
Yeah, and I agree, I've heard from various people in my family who are elder as well. It's like, I think saying your 20s is probably the toughest time in your life, because that's when you're supposed to find your life's goal, your life's purpose. So being in my 20s, I do see that pressure, I definitely do. I was agreeing with Dr. Seema Arora that I do think it's tougher than being in your teens, because you have to find your life's purpose and you need to know what your career path is and what makes you happy and all of those other pressures that you get when you're in your 20s too. But I do feel like young people need a supportive mental health care system to diagnose mental health problems that are affecting them. And nowadays we have a lot of mental health focused online support groups, and the fear of going in person kind of, I know there's like private mental health groups too online where you can make it more personal. And I think that these digital resources and support systems are a great potential in the future. And but they might come with their own challenges, but I think these digital platforms will definitely help the youth and the future of mental health.
That is so true. You all bring up really great ideas. So thank you so much for all of that. Now I do know that this is a professional networking platform as well. So I definitely want to bring up that professional sense too. So Dr. Raju Singla, do you have any advice you would like to give in a more professional career-wise for young Indian professionals of New England?
Follow your heart. Always, when you pick a career, whenever you want to do something in life, always it's important that you pick a career which you enjoy. Don't have to do it just to make anybody happy. So always enjoy what you do in life and try to be happy. That's the most important thing. And stay physically fit, eat healthy, stay healthy, and healthy mind, healthy body. And that's the key to success.
Yes.
And identify if there's any mental health issues, and identify them early. Look for resources, go to the right person. It is an illness which can be treated. It is just like a headache or heart attack or anything. It can be treated. There are different medications available. There is everything available now, online resources, counseling. And before it becomes like a major problem in your life, identify that and get help, get treatment. And the key is do what you want in life, and the sky's the limit.
For sure. Thank you so much for that. Dr. Seema Arora, do you have any career advice for the young Indian professionals of New England?
So sure, Niharika, just like Raju said, follow your passions. Everyone doesn't have to be a doctor, scientist, mathematician. Don't listen too much to your aunties and uncles in the parties comparing you to other kids. Each kid has their own strengths and weaknesses, and each kid is unique, and each of you actually have something or the other to bring to the table, and dive into your own talents and make the best out of it. You can be successful in anything. Sky's the limit, and I am possible. Just you can do anything. So if you do something that you're passionate about, success will follow, money will follow. And if you don't, then you're going to be suffering your life and you're going to be always regretting. So don't live in that regret. Just follow your passions. But yeah, I do say that you can take aunties and uncles' advice because they have, from their experiences, gone through a lot, and they can give you, some good advice. So sit with them, brainstorm, get their ideas, but do what your heart says.
True. Thank you so much for that. Divya, do you have any advice for the young Indian professionals of New England?
Yeah, though I don't have so many years of professional work experience, but I would just say the same thing: follow your heart, and do what you're passionate about, and success will follow, and money will follow, as we're all saying. So
True. Yes, that's some great closing words for today's episode. So thank you all for being part of the mental health discussion in the Indian community. This was definitely a powerful conversation to have, and I learned a lot from each and one of you about it. I hope our viewers will learn about this situation. It's a very critical and should be talked about in parties or on a professional setting as well. So thank you so much for that, and also thank you so much for giving advice about career-wise to the young Indian professionals of New England. So thank you all for being part of today's episode.
Thank you, Niharika.
thank you. It was a great session.
Thank you, Niharika. I want to congratulate you on the great series and the great work you're doing.
Thank you so much. So on that, yeah.
I said, we are so proud of you. You always make us.
Thank you. So on that note, thank you so much and have a great rest of your day.